Welcome to COVID-19 Outlook session. Good evening from Tokyo, and wherever you are in the world, good morning or good afternoon. It's 10:15 in the evening on Monday here, and the Tokyo metropolitan government just relaxed restrictions to allow restaurants to be opened after 10 p.m. And also the Japanese government expanded its stimulus package to allow more tourism. And we're in the midst of a 4-day long weekend, and a lot of people are traveling right now. I'm going to be the moderator of this session. I'm the executive director of the SDG coverage for the Asahi newspaper, a national newspaper in Japan. Let's see what the general situation is right now. WHO Executive Director on the Health Emergency Program just gave a briefing 2 hours ago. So this is what he said.
As speaking over the weekend, we passed 30 million cases around the world, and we're now fast approaching 1 million deaths. We're adding about 1.7 to 2 million cases a week to the global case count, and unfortunately between 4.5 and 5,500 deaths a day. When you look at the global epidemiologic curve, it appears very flat over the last number of weeks, but that belies a lot of activity underneath that graph in terms of the regions that are being more or less affected. We continue to see high numbers of cases in Southeast Asia, driven by the cases in India. We have very low rates of disease in East Asia and the Western Pacific. Africa equally, we have relatively low rates of disease, especially as the cases in South Africa fall. Leaving us really essentially with Europe and North, Central and South America, where the disease continues to be intense in its disease spread. And in particularly in Europe, we've seen an uptick in cases in the last number of weeks and are continuing to see similar upticks in cases over the last week or so in North America. The disease in South America overall remains stable, but again, within South America, some countries seem to be flattening the curve, other countries are experiencing fairly intense increases in disease. So what we're seeing around the world is a very mixed pattern. The pandemic is fully established and really at this point exploiting any gaps in our defenses that are there, especially in situations where we have high density metro areas where it's very, very difficult to suppress transmission.
That was Dr. Ryan, and it was in March, early March, when WHO announced that we have a pandemic. And now more than 200 countries are affected by the virus, and the infected number of people have exceeded 31 million, and the death toll is approaching 1 million. And the Johns Hopkins University reports that 80% of the deaths are now occurring in the developing countries. The feeling that I get is that when is this pandemic going to end? And it looks like the end of the tunnel is getting further and further away. And this global pandemic has had a damaging effect on our economies and societies. And the achievements we had made on SDGs have been seeing a setback. The World Food Program in its report says that we have a hunger pandemic. Extreme poverty is on the rise. The longer the pandemic lasts, the worse the health and economic social damage will be. In this session, we would like to focus on the broad impact of the COVID-19 and also look into the strategy of vaccine development and equitable distribution. We have a very, very dynamic panel. Let me introduce them. From Nigeria, Honorable Minister Osaji Ohanire is the Health Minister. And from the Bill and Melinda Gates Foundation, Dr. Anita Zaidi, the Director of Vaccine Development, Surveillance, and Diarrheal Disease Programs. And from Jamaica, we have Lydie Hudson. She's the Chief Executive Officer, Sustainability Research and Investment Solutions from Credit Suisse. So thank you all for joining us from all across the world. And first, I'd like to go to the Honorable Minister. You are from a most populous nation in Africa with nearly 200 million people. You have densely populated cities. Healthcare resources are limited, but we are not hearing that hospitals are overflowing with patients. What is your assessment of the situation now?
Well, the situation in Nigeria, we are looking at with some measure of relief and also some measure of anxiety. We had expected that we will be very badly hit because, as you have said, we are a densely populated country, and about 2 or 3 cities are very particularly densely populated. And when the first case came in here on the 27th of February, we expected the worst because we do not have the strongest of health systems. But we started very early to take the measures that we took, preventive measures, surveillance at the point of entry. And then after the first one came in, very aggressive contact tracing. And since then, we have been very proactive in tracing and testing and isolating cases. So since then, the situation has stabilized. Our hospital system is not overwhelmed. We're able to cope with the number of cases we are getting. And we cannot quite say we have flattened the curve, but we are trying very hard to make sure that our system is not overwhelmed.
How would you say about the level of compliance to restrictions?
Well, the level of compliance is difficult. At the beginning, there appeared to have been some compliance because there was some fear. But for some reason, people seem to have lost the fear, and the compliance is getting very difficult. We're using all measures of broadcast and advocacy and talking to the community leaders to restore more compliance with the non-pharmaceutical measures that have been instituted. We're still not quite happy with the level of compliance. We would like it to be better because we are also beginning to open air travel and to, in some areas, open school systems. So we will be worried if there'll be more problems after we open up the economy.
Let me go to Lydie. The global economy, so the unprecedented plunge after since the pandemic in the first half of this year. How has the virus affected the economy, and what is the outlook?
Yes, thank you. So as you suggested, the global economy has been quite severely impacted and pushed into a deep recession due to the lockdown measures and the spread of the virus. Quite clearly, there was some early optimism about a V-shaped recovery, and I'd say what we're seeing now is that, if anything, it will be a tilted V recovery. And in fact, it won't, the severe shock and recovery that we may have seen in the financial crisis of 2008, 2009 won't be replicated. And really, that's what brings today's conversation together so importantly, because the health and wellness of our populations are really what's critical to bringing the economy back.
Many people are worried about their jobs. They're worried about the virus and how long government support will last. What will determine the strength of the recovery?
Well, as you suggest, the government intervention so far has been material and very important to the environment that we see today. Despite the fact that there has been widespread contraction, government intervention has been critical to support, in many cases, consumer paychecks and household paychecks. I'd say that we would continue to focus on the fact that the public-private partnership is very important, and that government intervention and central bank intervention will be with us for some time to come.
Now, the Gates Foundation, let me go to Dr. Anita Zaidi. the Gates Foundation has been working for years on global health equity. Can you tell us from your point of view the COVID-19 impact on the general health of the people globally?
Yes. First of all, thank you for having me, and thank you for the World Economic Forum for organizing this event, which is a unique moment in time for us to all come together and talk about how to end this pandemic, which we cannot do without all of us, public and private sector, working together. So there is, as you said earlier, and the honorable minister from Nigeria, there is the direct impact of COVID on health, right? But there is a tremendous indirect effect that we are noticing of COVID-19, and especially in low resource settings, it is unbelievably dire. And if I was to summarize in a few statistics, for example, we've lost 25 years of progress on immunizations in 25 weeks. Immunization rates have dropped into 70% from 80-85%. We've lost 5 years of gains in the treatment for malaria and TB. We've lost countless lives, which will only be evident later on when surveys are done on from women delivering at home not being able to access hospitalized care. And if you look at the effect on poverty, which of course affects then everything else, for the first time in 20 years, we have an increase in poverty instead of decline. So the impact of COVID-19 on other health parameters around the world is just, it's grim. And it's depressing, and we have to figure out how to get the world to recover quickly economically so that we can take care of all of these health issues.
So you're saying that the impact on other infectious diseases is quite serious. The Honorable Minister, are you seeing that happening in your country?
Yes, we did see quite a challenge to the health sector, because at the initial phase, when there was fear on the one hand and too much focus on the side of government, on the other hand, on COVID-19, routine and essential services suffered a decline. We did see a decline in immunization rate in the skilled attendants and various other parameters in the health sector, which became alarming in some areas in the country. So we had to set up special task forces to address the challenge in those areas, and happily we were able to bring them under control. We are beginning to get better indices now in all those routine areas. We have not suffered too much damage. We are recovering and going back to routine services, and at the same time tackling COVID-19. So we're able to keep both aspects in good control.
I would also like to ask you, Honorable Minister, about the economic consequences. There has been a deep damage to the economy and society. And looking at Nigeria, the crude oil prices have plummeted, and your financial situation has declined, also from declining overseas remittance as well. With the worsening physical situation and the prolonged pandemic, I think it's going to be extraordinarily challenging for developing countries. What is the scheme for your government to bolster the response with a more difficult financial situation?
Yes, it is true. Nigeria suffered both a decline in oil production as well as a decline in oil prices. And that hit us very well as a country that depended very much on oil exportation. So there has been a lot of reordering of priorities. We have had to review the budget and create a different budget to be able to address the challenge. And a lot of fiscal measures that have been taken, stimulus has been brought in. And as our president always said, it is extremely important to save lives and also livelihoods. The lockdown and the restriction in movement created a lot of issues, particularly for daily wage earners and those who live from hand to mouth. And at the moment, we are at the phased withdrawal of restrictions and people are going back to their lives. We are reopening our airspaces, and they're also looking at opening schools, but at the same time taking very stringent measures to make sure that we do not suffer negative impact.
Lydie, there are so many countries affected and they cannot borrow. Some countries cannot borrow money so easily, or they don't have the powerful central banks to provide funds. And so many people are affected. At the forefront of your bank's effort for globally promote the sustainability issue, what do you think private sector and banks can do to spur economic activity and drive the recovery under this difficult situation?
Absolutely. So I firmly believe that the finance sector has an important role to play in the recovery. First, by supporting collaboration amongst all of the parties involved and supporting a nonpartisan approach to a discussion on how central banks, governments, and the private sector can come together to support a recovery. And importantly, I think that the banks have to, depending on the different regions that we're discussing, really be aware that, as I said before, health is the first point of principle. So not to push for a premature halting of government support to the extent that that really gives the time for the health and wellness of the populations to recover. I think, as you allude to in your question, there's going to be an enormous amount of international cooperation across the stakeholders involved. And that's really where I think financial institutions will play an important role to think through the changes in the labor market, the monetary policy, fiscal policy, and essentially how to engage with the labor force as well. So as you suggest, there is a it is not simple, and it's a very unique story depending on which part of the world we're talking about and where the virus has taken hold in more or less at this stage of the year and of the pandemic. But I do think that the financial sector and banks specifically have to play an important role in navigating that journey with in a public-private partnership.
Anita, from the philanthropic world, what do you think? How do you think philanthropic foundations can contribute in the areas for recovery in the economic front?
Thank you for that question, Hiroko. So philanthropy has a catalytic role, and the Gates Foundation, for example, argues very strongly for equitable access, and we put money in areas where we think that there is market failure, or the types of products that are needed for low resource settings are not available. And philanthropists have come together to support a lot of the activities that are resulting in tools for tackling the pandemic right now, but much more needs to be done by both the public and the private sector, because this is truly a situation where both the self-interest as well as the moral case are aligned, and without action by all of us, we are not going to solve this pandemic, end this pandemic.
Right. Yeah, you talked about ending the pandemic, and I think before economic and social damages can be recovered, I think we really have to address the pandemic, and it has to end. And the longer the pandemic lasts, the later the recovery will be. And I think key is vaccines. And speaking of vaccines, we hear numerous vaccine development programs are underway now, and we are waiting for when widespread vaccination will start. And we hear from the WHO that it will start around the middle of 2021 next year. And the question is, when we do have a safe and effective vaccine, will there be equitable access to the new vaccines?
Yes.
Dr.
So that's
Zaidi.
so
You're the
yeah,
director
so this is,
of the vaccine development. Do you really see a promising vaccine coming up?
So this subject is very close to my heart, and I've spent a lifetime working on vaccines, and I seriously believe and have seen vaccines as magical tools in preventing disease and keeping people healthy. And this is truly a situation for a stitch in time saves nine. If we want economic recovery, we need to have a vaccine, right? And we need to have a vaccine available all around the world. So when our vaccine is going to be available, has really been one of the positive things that we can see as the unprecedented science that has gone into the collaborative effort around the world to develop vaccines, and that's why you hear about so many of them right now, so many efforts. I am very confident that we will know that a vaccine works before the end of the year, okay? But deployment, which is a different thing, so for it to be widely available, for us to be sure that it's safe, will take a little bit more time. And so I think the WHO is making a very reasonable guess that that time is around the middle of next year. So we have what we call a wave one of vaccines, the early front runners, which are already in late stage clinical trials. There are several products from the US, from the UK, from China, also one from Russia that are all being developed at very quick pace, but we need to be sure that they work and that they're safe before they can be given to people around the world. So that's what the work is right now. And then there is a second wave of vaccines, which is right now going to be going into late stage development. And by that, we mean phase 3 clinical trials, when you're actually trying to see, does this vaccine prevent disease? And those will start in October, November timeframe. And so by the middle of next year, we will have an option and we will have choices of many of these vaccines, which are really critical to have many choices because we need to immunize around the world. Okay. And how do we make sure everybody gets immunized? That's where the world, we need financing from public sector and private sector to make sure that enough doses are made for the whole world, right? Not just the high income countries, but for the whole world, because without protecting people, especially the most vulnerable people around the whole world, we are not going to end this pandemic.
I know the Gates Foundation is very heavily involved in the global initiative called Covax. And this is aimed at working with vaccine manufacturers to provide countries worldwide equitable access. Why do you say this scheme, this initiative is so important? Can you explain to us?
Yes. So Covax is one of those, multilateral facilities that has been set up where the whole world can participate in financing the development and procurement of vaccines for their own citizens, as well as for citizens who may not be able to afford the cost of those vaccines. And because of the speed of this pandemic, what was done is that we used existing structures that were already multilateral organizations that had been set up after the Ebola experience, for example, for CEPI, the Coalition for Epidemic Preparedness and Innovation, which is a global organization that funds vaccine R&D, and it's supported by sovereign governments as well as by the Bill and Melinda Gates Foundation and by Wellcome Trust. And the other really critical organization in this is Gavi, which is has been there for 20 years, and Gavi has the role and has played an amazing role in immunizing children around the world with the financing from high-income countries around the world. And the third organization that's participating in Covax is WHO. And WHO is thinking through, ethical framework for vaccine use, equitable use, all of those things. So these organizations have come together and are working together in close cooperation in this entity that we are calling Covax, which is a part of the umbrella organization called ACT accelerator for access to COVID tools accelerator, which also looks at diagnostics and treatment for COVID-19 as well as vaccines.
Right. So I understand that Covax's aim is to raise $2 billion by the end of 2020, and I think so far at least 80 rich countries and territories have signed up, and using these raised money when the vaccine is available, lower and middle income countries, and I think the number right now is 92, they will be subsidizing for the vaccines.
That's
Honorable
correct.
Minister, Nigeria has signed up to Covax. Are you optimistic that it will secure equitable supply for your country?
Yes, I'm hopeful. Let me put it that way. And I think that this is an excellent initiative because it looks at the interest of low and lower middle income countries and more or less, let's say, fights a battle for them. The COVID-19 is a global problem. It is a pandemic, and I cannot really imagine any other infection that has spread around the world in such a record time and affected so many countries, so many countries and so many people. It's a problem of mankind, and there should be a solution of mankind, and mankind should be seen as just one. And I think that the initiative of CEPI and Gavi and WHO is exactly the answer we're looking for. And we hope that the production can be at such a scale that all mankind can be taken care of, and not just a few. We strongly support that initiative.
But there have been
Can
cases.
I make an additional comment on that, Haruko? Yes, so actually today is a really critical date because we had to have binding commitments from the high income countries for how many doses they will procure and subsidize. So we should know much more today of what this looks like and how much we can do around the world. And I'm very optimistic about this.
So the rich countries have to make their commitments. The deadline is today, but
it was Friday.
It's Friday. I see. But we have been worrying about vaccine nationalism. I think every country would like to secure that the first line of distribution of vaccines, when they're approved, they would like to distribute to their own citizens. And I think there's so many bilateral negotiations also going on. Do you really think vaccine nationalism can be prevented?
I'm not sure.
Honorable Minister, first, please.
Okay.
Yes, I'm not sure it can be prevented, but it can be discouraged because, as I said, this is a problem of mankind, and it is mankind that needs to be saved. And if you save many people in many countries, it is better than saving everybody in one country because the world will be very different. So I think that should be the target, to save all of mankind and to encourage the production of this vaccine at multiple sources and at a rate that allows the maximum number of persons in the world to be attended to.
Anita, you think that this scheme would really discourage wealthy countries?
So the idea is that the global leaders think about the whole world. And if you have a rational approach, and in fact, I would recommend that our participants read the Goalkeepers report that the foundation put out, in which there are detailed analyses about what is the most rational way to use the vaccine to end the pandemic quickly, and what will get us to a faster economic recovery. It actually is a global approach rather than using vaccine only in your country and giving it to low risk people. We get better results, better return on investment by using the vaccine around the world to prevent infection in the disease in the high risk people. So I like the way that the honorable minister phrased it, that Covax is meant to elicit a global response from high income countries and to discourage vaccine nationalism, and I think we will see today, once the binding commitments are revealed by Covax, how many accepted the challenge.
A recent Oxfam report, though, says that a small group of rich nations representing just 13% of the world population have already cornered more than half of the future supply of leading vaccine contenders. And most of the world population will have to wait longer.
Yes, so we are. Yes, so Covax is working very hard to avoid that, and to make sure that vaccine is available for low middle income countries. Gates Foundation, we at the Gates Foundation are also working very closely with Covax, as well as thinking about what we can do to ensure that doses are available for low resource countries through, for example, vaccine manufacturers in India who are getting into tech transfer arrangements with the big companies that have the early product, so that vaccine is available around the world, not just in high-income countries.
Minister, we have had cases in the past where new vaccines were distributed almost entirely to the wealthy countries. We have had bad examples, Honorable.
I don't think the world has faced the kind of challenge that we face with COVID-19. And again, our preference and our wish is that there is equitable and fair distribution of vaccines when they become available. And I believe that the license to produce this vaccine should be made immediately available to all countries that are able to do so, so to increase the availability, because increasing the availability very rapidly and very aggressively will also solve part of the problem and leave those countries that cannot actually push for themselves also protected in a way. Again, I say it is a problem of mankind, and it is mankind that needs to be saved, not just a fraction of it.
Lydie, you have been listening carefully.
Sorry. Can I make one additional point?
Okay.
So, yeah, sorry. So let me also add that right now we have we will get some money from the countries that participate in Covax. It will not be enough to vaccinate everybody. This is a problem that for 2021 it may be enough, but all of the people cannot be vaccinated in 2021 in 6 months. A lot of the work will have to be done in 2022. And we will need $10 billion for vaccine procurement for the whole world. And that money still needs to be raised by all of us, working around the world, public sovereigns, as well as private philanthropy, corporations, the types of people who attend the World Economic Forum to be able to get this job done.
Yes, Anita, you just touched on the point I was going to ask to Lydie, because unprecedented funds are needed to implement the scheme, the initiative, the Covax initiative. How can the financial community contribute? And everybody can understand that equitable vaccine distribution is a better investment than one country or the wealthy countries distributing it more to itself. But how can you encourage equitable distribution through the process of financial community contribution?
Sure. So I'd answer the question a few different ways. The first is that I would just take a step back and and remind the audience that the topic of ESG and sustainability has been increasing in mind share over the last many years. But I think that COVID has really reframed the discussion to be more inclusive beyond what has the broad preponderance of discussion has been around the E or on climate. And while COVID and climate may have a connection, I think we're really going to see much more about S and society going forward, and perhaps COVID has reset a bit of that discussion. But nevertheless, the focus on ESG and society going forward is incredibly important for the financial sector. And as I described before, we believe that the financial sector plays a very important part. To add to that, I'd say that we as a corporate have a lot of insight and intelligence, as do many of our peers and many players in the financial sector, to understand how the virus is moving around the world and how it's impacting our clients, our people, our societies that we operate in. And I think that intelligence and information, much like a replica of a government, but globally, if we can put that information together with others, and as described, with NGOs or in a public-private partnership, we can really begin to understand the decisions we take in each of the sectors that we operate in and how those impact the kind of economic recovery that we all are very interested in helping persevere. But finally, and probably most specifically to answer your question, we do believe that there is going to be an important role for the financial sector to connect investors or corporates who want to play a part in either the production of the vaccine, the distribution of the vaccine, or other ways in which we can actually ensure a path to recovery on health and wellness, and then ultimately assurances the labor market can recover. So I think there's a broader array of how the private sector can play in. Of course, the financial sector plays an important role of connecting financing to many of the participants who will require financing going forward. And I think that will continue to be a central discussion with governments and central banks.
Lydie, all the possible steps that the private sector or the coalition with stakeholders could make is very encouraging. Are there concrete movements or moves that are taking place, especially on the sharing information for the networking of information?
Yeah. Well, I'll speak specifically as a resident of Switzerland, although, of course, this is one of the wealthier countries. But the information sharing here amongst the government, the central bank, and then other corporates has been very important. And obviously, we have a number of the marquee pharmaceutical and biotech companies here as well. And in fact, that was one of the reasons why we were able to offer very early in the crisis. We recognized the need to create a facility for small and medium enterprise financing. And so I would expect that in this first phase, it's somewhat of a country specific, depending on which markets you're operating in. But at least I know from my perch that we are very engaged with each of the local regulators in the markets that we operate in describing both where we are from a workforce and employer perspective, but also how we can play an important role in the economic recovery.
Great. Perhaps I can take questions from the viewers. I have a question for Lydie from the audience, saying that, have we already experienced the worst of the global economic shock?
I would not want to be the person who's making a prognostication. I am not an economist. However, I'd say that we've obviously seen quite a material degradation in the economic environment, and the uncertainty that we saw in the late first quarter, early second quarter likely wouldn't be replicated. But given where we are and some of the discussions of second or third waves that we're seeing across Europe and the emerging markets, I think it's as I said, it's not a V recovery. Perhaps it's a tilted V, but it's slower going than some of the optimistic cases that had been called for earlier in the year.
And there's another question. I don't know, should I address it to the Honorable Minister or to Anita? Asking, how can we better recognize the successes that some of the developing countries have had dealing with the pandemic and share lessons with the global north? Honorable Minister, perhaps?
Well, I think in the first place, for those countries who didn't have a very strong health system, the strategy was to be early and to be fast in responding to these challenges of this outbreak. And in Nigeria, we started very early and very fast and very aggressive tracing. Right now we are more or less in something that looks like a steady state, but by no means complacent, because when we see the news and look at the second wave and threatening third wave and reduced and repeated lockdowns, we worry about that. So we continue our vigilance. Figures are being constantly monitored, and we very serious with surveillance and testing and tracking. And that, I think that's about all. But I think it's watchful waiting and observing the scene both internally and also externally. We are looking at the international scene very closely and learning lessons from them. And things that we thought were not done properly, we correct. And things that we thought were done, we copy. Done correctly, we copy. So to measure right now, I think it's too early. We can't be very sure. And if we want to conclude so early, we might make mistakes, as some did when they found themselves in a second wave.
Anita?
I can make one quick comment, which is in the preparedness that has happened because of the global polio eradication campaign in some low resource settings has come in very useful. And eventually in lessons learned, this will be a pretty important lesson to learn as to what preparedness activities had taken place because of polio that led to early control of COVID in some countries. Because it goes to okay, if the world is prepared, this thing should not happen again, right? That is a very important lesson for us to learn.
I just heard in Africa, the wild polio has been eradicated.
Yes, Nigeria was the last country to do that, actually. And we have now received our certification as polio-free. The last speaker was quite right, that helped us a lot because we are already on our toes as matter of watching out for disease outbreaks, viral disease outbreaks. So we did benefit considerably from the experience of polio and other viral diseases.
Well, I'd like to thank the panelists for joining us. And maybe I have one last question if anybody wants to have a go. How can we better mobilize cooperation? We need cooperation in so many different fronts and for the global common good. How can we do that?
Well, I think you are doing that very well with this forum. That is a very excellent platform, which you're already answering that very question, in that by pulling people together like this, exchanging ideas, exchanging thoughts, and understanding each other's position. I think we're bringing people together. We are really mobilizing, and more opportunities for interactions like this will be helpful.
And I would add having more women in decision-making roles. You can see again, another point that we will learn and reflect is the countries that had women leaders have tended to do much better on COVID-19. COVID-19 the pandemic has had an outsized effect on women, and which is not just bad luck. It's because of the structural barriers that women face. And we estimate, for example, that the women's jobs, because they're frontline workers so often, are twice as vulnerable as men's jobs to being lost due to the effect of the pandemic. And so in our quest to build back better, that this is a really important gender equality. It's an SDG goal 5, is a really important goal for us to be focused on.
I could only echo my colleagues' perspectives, and I know we're at time. But I would just say that this, as the minister said earlier in the call, this is a challenge for mankind, and it will not, the virus does not discriminate based on which country you're from. So I expect that cooperation will continue as we recognize the need for that in order to really rid the world of COVID.
On that note, we have to end the session. I'd like to thank all the panelists and all the people who are watch this session. Thank you very much.
Thank you.
Thank you very much for hosting.